Well, good morning, everyone. My name is Christian Codrington, and I am pleased to welcome all of you to today's webinar hosted by the Immigrant Employment Council of BC, entitled Unlocking Employment Barriers to Leverage Immigrant Talent, a conversation with Uzma Shakir. My name, as I said, is Christian Codrington, and I've been practicing human resources for over 25 years with a number of organizations, including Best Buy Canada, Starbucks Coffee, and Children's and Women's Health Centre of BC. Most recently, I left the Provincial Human Resources Association, entitled HRMA, to start my own human practice called Forum Human Capital Management. I've been fortunate to have worked with the Immigrant Employment Council of BC on a number of occasions, and I'm honored to be part of today's conversation with you today. In his 2011 work entitled Thinking Fast and Slow, Daniel Kahneman discusses two types of thinking processes. He describes them as systems 1 and 2. System 1 can be described as automatic thinking and is a result of entrenched learning, well-rehearsed activities, effortless responses, experiences, and assumptions. Examples might include completing the phrase bread and butter, detecting hostility in the voice of another, or orienting to the source of a sudden sound. System 2 often overrides the impulses of System 1. It allocates attention to mental activities that demand it. For example, looking for particular features of a person, filling out a tax return, or monitoring the appropriateness of one's behaviors in a social situation. For today's webinar, we'd like you to keep that framework of thinking and processing in mind and apply it to organizations and their employees. There are times when automatic thinking, processes, and reactions prevent the best people from showing their best. What do we need to do within our organizations to build systems that might override System 1 thinking, the impulses, the unhealthy entrenched behaviors, to get the best from employees and potential employees? So without further ado, I'd like to acknowledge our featured speaker, Uzma Shakir. Uzma is the Director of Equity and Diversity of the Human Rights Division of the City of Toronto. She has been a community-based researcher, advocate, and activist. She has been the past Executive Director of the Council of Agencies Serving South Asians and the South Asian Legal Clinic of Ontario. From 2008 to 2010, she was the Atkinson Economic Justice Fellow and an adjunct professor, Department of Geography and Program and Planning at the University of Toronto. Uzma holds a number of degrees from countries including Pakistan, England, and the United States, from Bachelors of English all the way to Masters of Law. Her work in the city focuses on legislative and policy compliance, administering the Human Rights Office, embedding equity in all corporate programs, policies, and services, and developing equity resources. She has been an advocate, an organizer, a facilitator, and a writer and lecturer on diversity and diverse issues facing racial communities. Without further ado, I'd like to welcome Uzma Shakir.
Thank you.
Uzma, why don't we start with a little discussion about you? And when did you come to Canada? And talk a little bit about, expand on your bio and share your story of coming to Canada as a highly trained professional, and what were some of the barriers to employment that you faced?
Well, first of all, let me thank you for having me participate in this webinar, and I apologize to the participants. This is the first time I'm doing it, so if I look like I'm looking all over the place except the camera, that's because I'm looking all over the place except the camera. But in terms of my personal story, well, I came to Canada about 28 years ago. I made the mistake of marrying someone who happened to live in Canada. The big challenge that I have, and I think it needs to be contextualized, that immigrant experience is very different for women as it is than it may be for men. Being a woman was important because I had just gotten married, and within a year I had a baby, and that kind of defined my challenges to a certain extent. I had no personal supports. I was married to someone who I well, I was getting to know. I have a small baby that I'm still learning how to deal with. And on top of that, I have to worry about, what is going to happen to my career. And navigating the system is, at the best of times, is hard for people. But when you are isolated, you feel like you're a young mother with a small child. You don't know whether you have access to subsidized daycare. You don't have enough resources and information about society. So you think to yourself, you make a calculation. I'm going to get a job, so I better get paid enough that I can pay for my daycare as well as have some money left over. Otherwise, what's the point, right? So that's on the one side, and I think it's important to recognize that women immigrant different challenges. On top of that, of course, there are some generic ones like lack of professional networks. I mean, I was planning to go into the Foreign Service, and coming to Canada, I have no idea how to get into the Foreign Service in Canada. I had no idea that there was a public service exam I had to sit. I had no idea I had to be bilingual, and bilingualism doesn't mean Urdu and English. It means English and French. I didn't know whether my qualifications would be easily transferable, whether they even qualify for Canadian experience and Canadian jobs. There was, at the time, there were no mechanisms, unified, standardized mechanisms where my qualifications could be accredited and equivalencies established. And then on top of that, there were all these, what I call culturalizing my education and experience, and that's the reason I think almost fortuitously now, but in retrospect, but at the time, the only job I could find was in the South Asian sector, because I happened to be a South Asian and I had a facility with English language, but also in some South Asian languages. So almost by default, I ended up in a sector where it wasn't my qualifications that I had acquired that were important, but it was my qualifications by virtue of my birth and my country of origin that became important. And that's what I call culturalizing my education and experience. And I give you an example for, one time, for example, being invited to the school system to come and talk about my experiences. And I thought I was going to go and talk about all my degrees in English literature and international law and political science, and all they wanted me to talk about was arranged marriages. And I'm like, I didn't get a degree in arranged marriages, man. Like, I had an arranged marriage, I arranged it myself, but other than that, I mean, I don't have any expertise in it. And I was quite surprised that the school system would actually take the time to invite someone, an immigrant woman, to talk about something which is patently absurd. And on top of that, I think the biggest problem I had, and I think immigrants still continue to have, is that we don't know how to translate our skills into transferable assets. Like, we don't know. We look at our skills as a resume. Oh, I have done X, Y, and Z. I'm a doctor. I'm an engineer. I'm a teacher. I'm a da-da-da-da-da. We don't look at our...
I mean, that you've said so much. And before we continue, what I'd like to do is just invite the audience to, if they have a question, to ensure that they type a question in, and we'll be able to read and respond to questions as they occur. But you mentioned so many things there, Uzma, to start with the balancing the personal challenges you have as an immigrant to a new country, looking after family, with those of professional desire to make an impact and make a mark within the country. And then the challenges, most especially around transferring the skills you acquired in one country and making them speak and be relevant to employers in a new country. I think that says volumes to the challenges that most immigrants face as they maneuver the Canadian system. Uzma, what motivated you to work a bit on this credentialing issue that you speak about? We have on the slide the ITP skilled immigrants issue. Can you tell us a little bit about that and how you got involved in that?
Well, I ended up, like I said, I ended up volunteering in the social service, South Asian social service sector, and then eventually found a job there as the executive director of Council of Agencies serving South Asians. And we were a small NGO, and we were looking for a bookkeeper. And we had a Sri Lankan professional come to us. She was a certified accountant, had worked in KPMG or some large corporation in Sri Lanka, and could not find a job. And of course, she was extremely overqualified for our job, but and I was embarrassed almost to hire her, but I did. And I tried to give her the opportunity to say, okay, look, we are a small organization. We just needed a bookkeeper, but with your skills, maybe you can develop our financial policies. Maybe you can develop some practices for our organization that we would not have access to otherwise. And she was very happy to do so. And eventually, I'm happy to say that about a year ago, she told me she went on to work for other organizations. And 1 year ago, she told me that she had actually gotten her licensure in Canada. So we knew, from personal experience, and then when I was at CASA, the other thing that happened was there were about 30 South Asian doctors who wanted to organize because they were finding it difficult to get into the healthcare system by virtue of limitations that were placed on internationally trained physicians. And so I ended up organizing the doctors, and I remember at the first meeting, there were 70 doctors, but they were not all South Asians. They were from various different countries with different specialties and stuff. So immediately we changed the name. We were going to call them Foreign Trained Doctors Association, and we're like, no, we're not going to call you Foreign Trained Doctors Association because then you'll perpetually stay foreign. What we'll do is we'll call you Association of Internationally Trained Physicians and Surgeons of Ontario, because you are physicians and surgeons in Ontario, you just happen to be internationally trained. And that was a galvanizing factor for my organization, which then ended up specializing in access to professions and trade. And don't forget, we were doing this work in 2005, 2006, when access to professions and trades was not on everybody's agenda. It wasn't even talked about by policymakers at the time. But because the Doctors Association was so successful, we got the engineers to come on board, the pharmacists, teachers, etc., and we ended up doing a lot of work around access to professions and trades. While we were doing this work, we realized that one of the things that kept coming up over and over again was the concept of public interest. All the regulated bodies were telling us, we cannot allow internationally trained physicians or surgeons or engineers or whatever to get into the licensed profession because we have to, we have to protect the public interest. So we actually did a research study called In Public Interest, where we problematized the notion of public interest by saying yes, you have to protect public interest, but these physicians and engineers are also part of the public. They're not somebody outside of the public. They are part of the public, so their interests also have to be kept in mind. And one of the things we suggested in that particularly was to set up an independent appeals process, because what we were finding was that all these people would apply for licensure, sit their exams, etc., offer their credentials, and would be rejected for whatever reason. And when they wanted to appeal, they appealed to exactly the same people from within the regulated professions who rejected them in the first place. And we were lucky because at the time, and I'm a great believer that advocacy happens when all stars align themselves. For 10 years, you could be bashing your head against the wall, and suddenly when all the stars align, you look like a genius. And it just so happened that the minister of the time, Minister of Training Colleges and University, was Mary Ann Chambers, who was an immigrant professional herself. And she picked up on our study of in public interest and immediately clung on to that issue of appeals process. And she created, I remember, a commission which was led by Justice George Thompson to look at this whole appeals process. And out of that commission and its findings came the 2006, it was called Access to Regulated Professions Act that in Ontario that was passed in 2006. And out of that came the establishment of the Fairness Commission in Ontario to allow immigrant professionals a body, like an ombudsman almost, in terms of regulated professions. And so the reason I was interested, the reason we got interested was because our communities were telling us that here we are all these internationally trained professionals and we have amazing credentials and we are not able to utilize them. And then by virtue of our advocacy work, we were actually able to make a legislative difference. So that's basically the lessons learned is wait when the stars align themselves, when you have a critical mass, you may actually be able to make a difference, and you had to make a difference because there was no other way for these people to get into their professions. And today, the doctors, for example, access for internationally trained doctors to the medical profession in Ontario has opened up a lot. And when we started, there were only about 32 positions open for international medical graduates. Now there are over 200. They have access to accelerated programs. They can get into other programs through which they can get into their regulated profession. But one of the biggest challenges that I still have is that access to regulated professions is one thing. Again, I go back to what I suggested to you was a problem for myself is immigrants not knowing that if I am a doctor from country back home and I still want to practice something which is similar to my profession but not quite the regulated profession, where do I go? Right? Like they don't know that they have transferable skills. They have, they can go into public health, they can go into community health sector, they can go into public policy around healthcare, they can go into so many other professions that may be able to utilize their skills.
Uzma, you've shared so much in such a powerful example that we were able to actually change the law. Let's deviate a little bit from our structure here because there are some lessons for employers that don't necessarily operate within a self-regulatory environment. And recognizing foreign credentials always seems to be a challenge, whether it's trained physician, international physician, or let's say something that a non-regulated profession requires, a skill or a degree.
There are and how immigrant skills transfer easily into what they are looking for. And that's where I think it is extremely important to have some form of standardized process available, like some mechanism, some body, whether it's University of Toronto, World Education System, or whatever, some standardized body that can provide that knowledge, and that is accepted by everyone. One of the biggest problems we had was that often people would go to University of Toronto, get their credentials, assessed, and then some regulated body or somebody says, oh, I don't recognize it. And that is a problem. People have to be able to have a reliable, standardized mechanism that they can then say, okay, I'm looking for X, Y, and Z. Here is a person whose qualifications have now been translated into something that I understand, and now I can look at it from that perspective. So I think that was what you... Sorry.
No problem at all. We are having a little technical issue here, and I just wanted to make sure you could hear me okay. But we do have a couple of questions from our audience, and one is a comment saying poor English skills seem to hold new immigrants back more than any other factor. Free ESL provided by government for a standard number of hours just doesn't seem to be enough. And then they're commenting that new immigrants end up remaining isolated in the workplace because they can't communicate effectively. Any thoughts or initial reaction, certainly as a new immigrant and experiencing that barrier that the language can pose?
Language would always be a barrier. I never had that barrier. As you can tell, I have a fairly good facility with English language, maybe a little too flippant at times, but nevertheless. But one of the things that is happening in Ontario, and I don't know if it's happening in BC as well, is the colleges have stepped up. And colleges are not just providing ESL, that is English as a second language, but they're actually providing what is called sector-specific language. often enough, it's not just, English facility or facility in conversation can also come by just working in an environment people learn. Sure. But what sometimes can be a barrier is that you may know terminology that in your country of origin, and maybe in Canada they're using a different type of terminology in that particular sector or in that particular field. So absolutely, I mean, colleges have stepped up. They offer dedicated programs on sector-specific language so that immigrants can take those courses, not ESL as a general language, but actually sector-specific language to make them more comfortable with it. The rest comes with being able to use it in a workplace. I mean, it's a catch-22 situation. People say you don't know English, but then you don't get an opportunity to actually be in an environment where you are forced to use the English language, and you will learn. I still make mistakes, and I know English really well. But I mean, it comes with, it's like a two-way street. I mean, you create the conditions for people to come in. If they cannot use technical language, I think that's a technical piece that can be provided, and people can take courses in it. But the rest comes with just facility of language. Using it in workplace.
I can't help but gravitate to your comment you made around it's a two-way street. And while I agree that it's critical that new immigrants learn English, it's also critical that employers be patient around the language provision. And what I often find too is that employers may need to work a bit harder and sometimes are hesitant to work a bit harder to understand individuals that may struggle with English as a second language.
Also don't forget, our demographic is shifted, so our clients and our so-called customers are also diverse.
Yes.
So while on the one hand you may say, oh, I don't understand your accent, well, your customer may be very comfortable with that person because they understand their accent perfectly. I mean, I have tremendous difficulty when I first came, and I still do with Scottish accents, but I get used to it. I mean, it depends on what you are used to. And quite frankly, I think, I agree with you. I think people use language differently given the, how familiar they are, or how much facility they may have, but that doesn't stop them from being able to utilize their skills, their innovation that they bring to the job, their ability to solve a problem for which they have been hired, or do their job for which they have been hired. I think these are two different things, and people have to keep that in mind.
Uzma, we have one other question from the audience, and more particularly around the example you gave around the doctors. And what did the internationally trained doctors actually do to move ahead in their profession?
What did internationally trained doctors do to move ahead in their profession?
Yes.
What does that mean? I'm a little confused.
Well, I think the example you gave was that we had a shortage of doctors and they were having a difficulty either being recognized or moving ahead. Do you have any particular examples of what some of these internationally trained doctors actually did to be recognized and move ahead?
Well, I mean, we organized the Doctors Association, and they were able to very effectively work with the College of Surgeons and Physicians of Ontario to a point where, for the first time ever in the history of Ontario, they held a joint press conference where the College of Surgeons and Physicians actually use our International Doctors Association to set up a portal on the college's site for internationally trained professionals to get the information that they need. And they used us because we had all the doctors. We had over 2,000 doctors in our database who could tell you what is the type of information a new doctor would require in order to be able to go through the licensing system. So we prepared all that information. We did a lot of outreach, within different medical communities. We reached out to rural communities where there was the greatest shortage of doctors, and encouraged them to actually give what are called, residencies to internationally trained doctors. You pass all your exams, but if you don't get a residency, you can't get into the system. But rural communities had such severe shortages of doctors, and some of them were amenable, but some of them turned around. I remember one rural council turned around and basically said, well, our communities are not comfortable with women doctors, let alone Iranian doctors. So I mean, you know what? that's where the bias comes in. That's where the, if people are more worried about an Iranian doctor than the fact that you have to drive 3 hours to find someone for a headache, I mean, I think, well, we have a bigger problem than the Iranian doctor then. So a bunch of doctors, for example, I didn't have a family physician. I moved into a community in GTA, Greater Toronto area, where no doctors were taking new patients. So I waited for one of our members to actually get their license, one of our members from our internationally trained physicians and surgeons of Ontario, to get a license. And the moment she got a license, she called me and she said, I have a license. I was her first patient. Because I thought, you know what, this is sweet. This is really nice that we advocated for them. She's gotten through the system. And now I find many more internationally trained doctors are getting into the system just because the system has opened itself up. A lot of them, my advice to them is, because I do a lot of mentoring, my advice to them is to look into alternate professions. For example, I work at the City of Toronto, public health. Public health, is always looking for medical professionals, not doctors, medical professionals. So I always encourage them to look at public health. I encourage them to go into community-based healthcare clinics that are also looking for people to do community outreach and around healthcare issues, etc., etc. There was a fabulous and very innovative project that was delivered by one of our member agencies when I was working at CASA, which was entirely developed and delivered by internationally trained South Asian doctors. They got funding for 3 years from a US-based multinational private foundation. And what they did was they identified key health issues within the South Asian community, diabetes, health, osteoporosis, whatever, and developed linguistically specific healthcare material for the South Asian community. And they actually went into the community and delivered community health workshops. Can you imagine the skill set that went into it? Like, I couldn't have paid for it if I wanted to. And here were these South Asian doctors saying, we want to work with our community. We have the healthcare qualifications. They have the need. We have the linguistic facility. They need the information in a language that is suitable for them.
I think clearly, Uzma, we've tapped into a controversial issue, and one that we could probably spend the rest of our time together. But in the interest of balancing the rest of the content of our webinar, what I'd like to do is just offer a comment from one of our participants and then move on really quickly to our next slide. A comment from one of the participants: a friend has taken their son to a pediatrician who is qualified to practice in Canada but cannot understand the English. And I don't want to put that out for discussion. I realize that the issue around English language is a controversial one, and comprehension of English. The reality is it's a two-way street that I think both the foreign trained professional as well as our customers and our employers need to sort out answers to make it easier for both customers and employers.
I do want to say something. I know of, if you're going to get into these kinds of examples, I can give you 100 examples here of people who have gone to the doctors and, because the doctors don't understand their language and they can't speak English, their 5-year-old child is interpreting for them and being their caregiver in terms of medication. So it goes both ways. We have a very diverse population in Toronto. We have 80,000 Somalis, not one Somali doctor. Not every Somali who's here needs an English-speaking doctor, right? So, like, what I'm suggesting is, if you're going to get into examples, there are multiple examples, and there are all kinds of people who have barriers. So it's not just I understand if there is a doctor who doesn't speak English and you take your child and they are having difficulty understanding them, that's a problem. But I know a whole bunch of Somalis and South Asians and Chinese who go to the doctors and their doctors don't understand Chinese, Somali, or South Asian.
Uzma, why don't we move on to the issue for employers, and really quickly, let's talk about why this is an important issue for employers.
Well, some of it is so basic, right? Like, let's face it, our demographic is shifting.
Yeah.
Our consumer base is shifting. I mean, in city of Toronto, for example, over 50% of the population is non-Canadian born and immigrant to boot. I mean, it just makes sense. And private sector is right on it. They're the first people who, you go into banks, in a predominantly Chinese neighborhood, and you will have all the frontline staff, all the ATM machines with Chinese, instructions, etc. So I think that goes without saying. The other factor, major factor that I think we need to pay attention to is that labor market replacement. I mean, 100% of the labor market replacement in the next 20 years is going to be through immigration because Canada's population is aging. So, we need to be cognizant of the fact that our, immigrants are here to stay. They're not going away. They're here to stay not just because they need to be here, but because we need them, right? Thirdly, global economy. I mean, we are living in a globalized environment. The globe is sitting right in our backyard. If you want a competitive edge, guess what? We have all this ready-made resource, man, who has access to global markets and global economies and global culture and global corporations and global businesses. And you don't need to do anything. You don't need to train people to go and learn South Asian culture. You can hire a bunch of South Asians and send them to South Asia. My God, I mean, don't we want to do business with India? Everybody wants to do business with India. You've got Indians sitting right here. The other thing is, this is something, there's an Indian physicist, she's actually more into environmentalism and, talking about agriculture, etc. But she used a terminology which stuck with me. And she said, in terms of, crops, she said, diversity allows for production of alternatives. What she was talking about was that if you have one type of crop and something goes wrong, you starve, right? Or you don't make money out of it. But if you have diversity of crop and one fails, the chances are others might not, right? So she used a terminology called production of alternatives. Diversity allows for production of alternatives. And I think that's a very compelling reason for employers. And if that weren't enough, I actually heard, I thought I'd died and gone to heaven. I heard the VP of HR at RBC, Zabeen Hirji, once say in CBC interview, she said, I look at immigrant talent by saying, that's the talent that I don't have right now. That's the experience that I don't have right now. So if I get them, guess what? I now have an experience and talent I didn't have before. And I thought, oh my God, what a positive way of looking at it. And I think she's sort of articulating what I'm talking about in terms of production of alternatives, right?
Correct.
So I think these are compelling imperatives for employers. And not to mention the fact that, hang on a second, not to mention the fact that I'm talking about private employers. The employer I have, which is the government, we have double bottom line, right? We have not only the bottom line in terms of profits and competitive edge, our bottom line is our population and their health and well-being. Imagine the more people are employed, the less chances are that they'd be reliant on other services that we deliver, social services, unemployment services, housing, etc. So, what you give with one hand, you take it away from the other, right? So, I mean, it's in our interest to encourage both people to work with us as an employer, but also to encourage that culture in society, because it reduces their reliance on social supports.
Uzma, you've said a lot already in our first half of our webinar, and we've already engaged our audience with a number of questions, but perhaps what we'll do right now is move to a poll question. We've talked a little bit about some of the reasons why. Why don't we ask our audience simply by indicating on their computer an answer to the following question. What is preventing your organization from being more inclusive in its diversity practices? And I believe the answer the poll is open. And we'll just look for your results, and you can pick more than one. And it'll be interesting to see what some of the initial responses will be. I'll give you a couple more seconds to reply. And if we could just get our... Again, the question is, what is preventing your organization from being more inclusive in its diversity practices? And if we could just close that poll now. How are we doing? Okay. Let's see how we're doing here. So it looks like we've got about 80% response so far. And it's simply, it looks like 36% of you have indicated simply a preference for Canadian experience is one of the issues facing your organization around being more diverse, which really summarizes, I think, the first half of what we've spoken about, isn't it, Uzma?
Yep.
So how do we have simply open up our line managers to the possibility that international experience can be as valuable? Let's move on, Uzma. What do you feel are some of the barriers that immigrants are facing, and what can employers do differently to address those barriers?
Well, one of the things I've always found is, like it says on the slide, lack of policy cohesion. There seems to be a disconnect between, or at least I hope there is less of a disconnect now, but there's still a disconnect between the three levels of government. I mean, federal government sets our immigration targets and criteria, etc. Provincial government set our regulatory requirements, and people live in municipalities. And I think that one of the things that Toronto Region Immigrant Employment Council and Immigrant Employment Council in BC are trying to do is to bridge those three gaps, because it really doesn't matter to the individual who has been brought in by immigration criteria and is going to be regulated by provincial criteria but is living in the city of Toronto or city of Vancouver. To them, they need a policy cohesion. How can we are bringing these immigrants for a particular reason. How can we utilize those reasons to the best of their, not only for them to be able to meet their needs, but us to meet our needs. The other is implicit bias. I mean, there is a level of bias in, not just against, it's not that people who are doing hiring, etc., say, oh, I'm not going to hire X, Y, and Z. Maybe some of them are, but I'm hoping we have gone past that. But it's also a bias for. We feel more comfortable with someone who looks like us, who talks like us. I mean, my God, if that was the criteria, I'd never have a job. But I mean, really, I mean, people look at other people and want to replicate themselves, right? I mean, women have seen that all along. One of the reasons why male preference seems to show up in CEO levels is because, one male thinks another male is the only one who can run in a corporation and not a woman, right? Well, it's the same thing. So then there is, again, this entrenched discourse of Canadian versus other. As far as I'm concerned, there are two types of people in Canadian labor market. Those who are trained in Canada and those who are trained someplace else. It's not Canadian versus someone else. It is Canadians. All of them are Canadians. We chose to come to this country. We are landed immigrants. We become Canadian citizens. We are all Canadians. That's not the point. The point is some of us were trained here and some were trained somewhere else. And we need to be able to understand both sets of skill sets and both sets of qualifications. And then, of course, not focus on immigrant deficit. And I think we've moved way beyond that. I don't think people any longer look at immigrants as children of a lesser God. And if they do, they have a much bigger problem than what you and I are talking about. And the last thing is, immigrants themselves don't know how to market themselves in terms of their transferable skills. How do I take what I have, my experience, etc., over and beyond professional credentials? I'm a doctor, I want to become a doctor. No, I'm a doctor, I have all these skill sets. What does it mean in not just Canadian society, but in 21st century society? I mean, societies are changing all across the globe. Work is changing everywhere. The nature of work is changing. So I think that is a barrier too.
And based on what we heard from our audience, the similarity around in answers. The difficulty in translating skills and education into alternative professions can be simply viewed equivalently to preference for Canadian experience. It's simply easier to recognize that which we know.
Absolutely, absolutely. It's just comfort level, right?
Let's change the language a bit, and maybe let's focus on some practical steps that employers can take to overcome some of these organizational biases. What would you recommend that employers start with to first mitigate barriers and then create more inclusive workplaces?
Well, first and foremost, I will use City of Toronto as a really good example, both of what works and what doesn't work, by the way. But first and foremost, make a bold commitment. Don't be, dilly-dallying about it. Oh yeah, make a commitment. RBCs of this world, KPMGs of this world, Deloittes of this world, City of Toronto of this world are making a bold commitment. Diversity as strength. That's City of Toronto's motto. Probably not everybody understands what it means, but nevertheless, that's their motto, right? And in order to show that that means something, one of the things City of Toronto has done is the only jurisdiction in Canada that I know of that went and created a dedicated division called Equity, Diversity, and Human Rights and located it in the city manager's office. The reason the location is important is because equity functions usually are in HR, or human rights functions are usually in HR. They are not in the city manager's office, which gives it a corporate mandate. So anything, even though I have a teeny mini little division of about 13 warriors that I call them equity warriors, what we do goes for the entire corporation because it comes from the city manager. And I think that is important because it shows leadership right from the top.
And I think there's two things that I really hear when you say, no matter what the size of the organization, any organization can make a statement to say, this is what we practice.
Absolutely.
And no matter what the size. And when that's coming from senior leadership and not simply a department like a human resources department, it carries a bit more weight.
Absolutely. Absolutely.
Let's go on a bit further. What are some other practical steps employers can take to mitigate those barriers and create a more inclusive workplace?
Well, I mean, as you can see on your slide, I mean, as far as I can see that, you need to apply an equity diversity lens through the entire HR system. Be it outreach, be it recruitment, be it your common management framework, your leadership competencies, what your programming is around executive onboarding and succession planning, new staff orientation, corporate learning, performance measures and reporting. Everything should have an equity and diversity lens to it. And what I mean by that, I think is in the next slide, is that, for example, when you have a job description, focus on what are bona fide requirements of a job and not extraneous things. I mean, other things can change depending on what who the candidate is. I'll give you an example. I have written their CST, that's Children's Aid Society of Toronto. I was working with them as a volunteer at one point on their advisory board, and they showed me their job description, and they said, we require a MSW or BSW or whatever, et cetera, and familiarity with the child welfare legislation, et cetera. So I was saying to them, look, masters in social work is not a discipline in certain countries. It may be it's a discipline, for example, in India, but it's not a discipline in Pakistan. So you may have candidates who have really good qualifications in terms of, counseling, in terms of clinical psychology, in terms of sociology, in terms of whole bunch of other things that your job requires, but they may not have a BSW or an MSW because that's not a qualification that is offered in those countries of origin, right?
Right.
The other thing is you're saying familiarity, deep familiarity with child welfare legislation. Well, quite frankly, if I'm not living in Canada, even if you're living in Canada, you might not have deep familiarity with child welfare legislation until they show up at your doorstep, right? So my point is, why don't you hire people for their transferable bona fide skills and then use familiarity with child welfare legislation as your training, as your orientation. And you know what? It was a small conversation, and it was like an aha moment. Next thing I know, they're changing their job description, etc. Suddenly they had a problem. They kept saying we can't Our client base has changed, but our service provider profile hasn't changed. Suddenly the service provider profile was looking exactly the same as their client base, just because they tweaked their job description. Similarly, use equivalencies, prior learning assessment tools are a very useful. I think trades had started that, but I think more and more employers are moving towards it, and thinking how can we use other mechanisms in terms of assessing people's skills that can then be translated into what we need. Outreach practices. I mean, this is such a simple thing, but you post a job, and I think in your poll also people said, everybody is saying, oh, I'll just post it, and if they come, they come. If they don't come, they don't come. No. You reach out to the communities where they're at, or where they're most likely to see this job and be able to apply for it. The other very important thing that I'm trying to do at the City of Toronto is talking about, if you think implicit bias is an issue, which I think it is, by definition, because it's implicit, you don't know about it, but it's subconscious, diversify your hiring team. Diversify your, your selection panel. Again, production of alternatives, right? If you have diversity on your selection panel, maybe the way they view leadership or soft skills or, communication styles may be different. Maybe somebody finds my communication style a bit too aggressive and too pushy and doesn't think I'm great. Someone else thinks, oh my God, she's a firecracker. I want her. I mean, you know what? At least I have a 50-50 chance. But if everybody is looking at it, you know what I'm saying?
I think you raised some wonderful points there, and especially when it comes to diversity on the hiring team and ensuring that those that are on that team have a voice, an equal voice. But we also have a question from the audience. And Uzma, are you aware of any efforts being done to review the credentialing criteria in this country? The main observation from this particular participant is that the years spent in school may not be equivalent to the content. When this person received their master's degree overseas, it was assessed to be an equivalent to a bachelor's degree here. Again, to repeat the question, are you aware of any efforts being done to review our credentialing criteria?
I think there are organizations like, I know that World Education WES, it's called WES, WES. I know that they are trying to look at not only credentials in terms of, I agree, now years in school does not necessarily translate into practical skills. But they are also, I'm encouraging them also to look at the jobs that do exist. So for example, if they were to have a partnership with the City of Toronto, they could look at our jobs as they are and then look at people's qualifications and skill set in that context so that the equivalencies are relevant. So there are efforts being made. I'm not 100% sure how successful they are though.
This may lead to our next slide, Uzma, around what sort of deliberate action employers can take. What might not be on the slide here is what employers can do to start influencing different credentialing bodies. And I certainly know that we can influence our HR association around what's equivalent and what's acceptable when it comes to our designation. Maybe there's some other deliberate actions employers can take. Maybe you could expand on those a little bit, Uzma.
Okay. Well, I mean, in terms of what's on the slide, one of the things that I think a lot of, particularly at the city, we are trying to do is mentoring and internship programs. Mentoring and internship programs allow foreign-trained, internationally trained immigrants to actually come and speak to senior managers, people who are working within the city, and because they are matched according to their skills. So, for example, an HR professional will be mentored by someone in HR. They can get familiarity of Canadian experience, Canadian workplace, Canadian culture, Canadian requirements, etc., etc. However, what we need to pay attention to, for example, is then to turn that into a pipeline, into our own recruitment pipeline. I mean, City of Toronto, for example, is a huge, huge corporation. We hire 33,000 people. We hire people all the time. So it's not good enough for us to pat ourselves on the back and say, oh, let me mentor, your huddled masses, but to actually open up our own opportunities to those people who have now been mentored, have been made familiar about what we want, and then we can help them in terms of accessing our jobs by applying in the right way, writing their resume in a particular way so that it goes through our screening process, etc., etc. So I think those are like tangible things that we can do. The other thing that I'm always talking about is often employers have gateway programs, so like internship programs or gateway programs, but we do it for 6 months and we say, our private sector is better than government, we say goodbye. And my point is, why say goodbye? They've just gotten 6 months of your experience. Look at them as a ready resource. Like make actually in your recruitment process, make that an added bonus for them to be able to qualify according to your job description, because now you've actually trained them. Private sector is a lot better at it than the public sector. Public sector still tends to shy away from these kinds of things. The other thing that I find really problematic, and I think we can do so much better, is that when we don't make a link between, so we hire people, but then we don't make a link between that and monitoring whether the same person that we hired because they were diverse are now getting training and mentoring opportunities within the corporation, whether they're getting professional development opportunities, whether they're getting promotional opportunities, whether they're actually showing up in divisional performance measures. Because otherwise what happens is we hire people and then those people turn around and say, now within the organization I'm being discriminated against because now I don't have access to opportunities to go further. Then we look at our senior leadership and say, oh my God, we don't have any diversity. Well, you know what? Pay attention to it from the time you hire it to the time that they're ready to be senior managers, right? I think in terms of credential assessments, that's what employers can do. Work with credential assessment bodies so that their assessment and your requirements, there is a resonance between the two.
As I hear your deliberate actions bullet pointed out, I can't help but think it's about really purposeful succession planning and managing your people resources.
Deliberative, absolutely.
Mm-hmm.
Absolutely.
More than just HR, what else can organizations do around this issue of being more diverse and inclusive?
I can definitely speak from the City of Toronto's experience. For example, one of the things that we have done by virtue of the fact that we have diversity motto and our division is that now we are developing a social procurement policy. City is a huge corporation that does business with businesses. And what we are saying is, well, when you do business with businesses, how come you're not putting your emphasis on diversity and encouraging, be the change that you seek? Why aren't you encouraging those businesses to follow your desire to have diversity? I mean, a whole bunch of immigrants, for example, are going into small and medium enterprises. They don't get to bid on cities' contracts because they're so large. But large contractors then do subcontracting. So we are talking about diversity in the supply chain. We are talking about saying, why don't you, in your selection criteria, don't just say the lowest bid will get the bid, but also if somebody can show that they actually do businesses with suppliers who are diverse, who encourage diversity in their business, that, that is also part of the bottom line in terms of your bid. And I think we are beginning to do that, and we are right now piloting small projects, for example, up to $50,000. Not large contracts, but small contracts. Trying to make the contracts simpler, right? Like small and medium business is not going to be able to do the onerous bidding process, which requires a genius and requires professionals to write a bidding contract. Are you kidding me? Where will the immigrant businesses be able to do that? Simplify your bidding process, your application process. For example, we are saying, when people are, people come to you and say, I want to bid on a contract because you want to build a community center in a such and such neighborhood. Well, guess what? I'm going to bring, other than my price, I'm going to also hire locally. Youth, marginalized youth, give them training opportunities. Suddenly that bid has a social value attached to it. Not only diversity, but also social value, because we know that marginality has a color to it, has a race to it, has an immigration status to it. people disproportionately who are living in poverty also happen to be immigrants as well and newcomers. So this is one way of, stepping up. And the other thing that I think employers generally, but governments particularly can do is, again, build the capacity of the communities to be able to do business with the city. So not only set an example for large businesses, but also to build capacity of communities to be able to do business with us. And here, it's like one side helping the other. We give grants to community groups, for example, to set up small businesses, to set up cooperatives, to, women's groups, to people with disabilities, immigrants, all kinds of people, Aboriginal communities, right? It's like constantly, deliberately thinking, how can my outcome be equitable?
I love the constantly, consistently. I mean, it's being purposeful, isn't it?
Yeah, absolutely.
Let's move on. What are some other suggested mechanisms that you feel organizations should be doing to become more inclusive?
Well, I think one of the things, that particularly for large organizations, I think it is extremely important, like if you're going to, first of all, like I said, if you're going to make a bold commitment, then show it. Show what you have done. And for that, you have to count. You have to be able to say, well, you know what? We used to have 10 people, internationally trained professionals. Today, we have 20. Well, how will you know? You have to do some kind of, census collection of data. I mean, we are moving more and more towards data and digital kind of world, man. Everybody deals with data. So do employers and so do governments. They must. Not only that, we need to do some, like national occupational categories. No, not just who's working, but where are they working? And monitor it over a period of time. Again, being deliberate. I hired 10 people today. 25 years later, where are they? What are they doing? Have they left? If they have left, why have they left? Employee engagement. Put demographic information into employee. Don't just ask people how satisfied you are. See if the level of satisfaction and their immigrant status, their racialized status, their gender status has something to do with it. So that you can actually address those barriers in a purposeful, meaningful way. And always, always, always collect disaggregated data. By that I mean is don't collect generic data. Collect data according to demographic information. Around all the protected grounds of the code, of the Human Rights Code, around, racialized people, Aboriginal people, people with disabilities, women, youth, seniors, whoever is working, like collect that data so that you know who is actually progressing, where are they progressing, and are we making the difference that we wanted to make.
And Uzma, if I could stress the link between one of your earlier comments around being bold and making a commitment. I've been working with one employer who has started collecting data on their employees and wanting to know whether or not people will self-identify as being disabled. And yet they're concerned that not one person has self-identified, nor will new applicants. Yet they don't have an organizational commitment as to why they're even collecting this data, what kind of employer they are. So I think the reason, right? Collection of data can't be an absence of stating that this is, you are supporting diversity in your hiring and human resources practices.
Christian, we have spent hundreds of years of using things like ability and gender and race and class to marginalize and disenfranchise people. We better be very obvious and open about it. People are distrustful. Nobody's going to tell us they have a disability because they think they're going to kick me out if they find out I have a disability. But if you say, I am 100% committed to making City of Toronto, Province of Ontario, 100% accessible by 2025 because of Accessibility for Ontarians with Disability Act, it's my moral, it's my professional, it's my legislative obligation. Everybody will suddenly say, oh, okay, so I'm not going to be treated in a differential manner because I declared my vulnerability. And that the onus is on us. Onus is on the corporation. Onus is on leadership. Onus is on management to be able to convey that I am a progressive, insistent, deliberative, diversity, and equity-based employer.
And we need to show that consistently, not just with a statement.
Consistently, absolutely.
I'm curious to know from our audience who currently tracks organizational performance or organizational demographics, and would love to see a reply to the poll question. Do you currently track organizational demographics? And there are 4 replies coming on your screen, and would keep the poll open for a bit, and look forward to your replies. You can answer to multiple responses. Just remind everybody that you're not precluded to answer just one.
You know, this should be very interesting.
And we do have a lot of large employers participating, so I anticipate some of the you know, greater than 500 or more will be answering it affirmative on this one. How are we doing on terms of numbers? We've got about 26%. So let's see what we've got so far. So of those that have answered so far, 100% review engagement survey data along demographic statistics. And look at these numbers. 80% ask for and report on demographics and use that information in their HR planning decisions. But the numbers go down a bit when it comes to reporting the data back to all stakeholders. Any initial comments when you see those numbers, Uzma?
It makes me feel good, man. It makes me feel good. This is brilliant. This is brilliant. This is exactly what I was talking about. This is absolutely amazing. Maybe I'm moving to BC, man. I'm moving to BC. Because at Sydney, it's like pulling teeth to ask for this data.
Is that right?
Yeah, it's very hard.
So once we have that data, then what do we do with it?
And that's where the accountability piece comes in. Because, you know, collecting data is fabulous. And using that data in our decision making is even better. But how do people know? How do people know? And if you report, I mean, if nothing else, if your decision making is based on rich data, people will look at you and say, oh my God, what a brilliant, you know, what a brilliant employer. They're actually putting their money where their mouth is. So it is extremely important to report back both to the employees as well as to the communities. It builds trust, it builds confidence, and more importantly, you become an example for others. And I think that is very important. If you're going to have societal change in terms of attitude towards immigrant skills, immigrant qualifications, immigrant credentials, immigrant hiring practices, then employers need to step up. Those who are actually good at it, to be able to step up and say, you know what, I did this and I learned from it. And I'm willing to do more of it. And I'm willing to work with other employers. And that's why, for example, Toronto Region Immigrant Employment Council in Ontario has all these large employers who are like a network to other employers. Because other employers, if they need support, it's not just the immigrants who need support, but other employers, if they need support, they can actually, you know, learn from their colleagues in the field, outside the field, learn best practices, share best practices, and an organization like IEC can actually produce, you know, like modules, like curriculum, like, you know, mechanisms, learning tools that employers can utilize to do better outreach, to do better selection process, to do better in terms of job descriptions and credentials and what they think is a bona fide, you know, making a distinction between bona fide requirements and other requirements that you can actually change and in order to accommodate diverse skill sets. I think this is great.
Uzma, do you have any thoughts around how small, or how big, I should say, an organization must be before they start tracking trends? I mean, many small businesses in BC are 5 and under. You can track performance in their head.
Yeah, they can eyeball diversity there. I mean, I think if you have a hierarchical management structure, because your organization is large enough that no one person can manage everything or no two people can manage everything, I think you should be collecting data. If you can't eyeball your employees, you should be collecting data.
We have a question here that I've had for a bit, and I'll just come back to this one right now. We were talking about English and English as a second language. One question from the audience was, are employers responsible for paying for English lessons for their teams?
No, I don't believe so.
While employers aren't responsible, we've showcased a number of employers who actually do pay for that. In fact, they've taken the initiative to hire for the skill that's necessary to do the job, whether or not English is a second language or not, and invest in language training under the premise that it's easier to train English than it is to train in the technical skills required to do the job. And that was one employer here in BC. They've designated significant funds towards English language training for their staff.
But think about it this way. You send your high achieving employees to management training programs, to professional development programs, to executive management programs. Why can't you take say a South Asian or a Chinese immigrant who has come here and has totally amazing technical skills but lacks language facility, and train them in that? I mean, I think every business should look at, is it worth my investment? And I think it is worth your investment. I'll give you an example. I went to Sault Ste. Marie, and I was there was a company there, and there was the large company, manufacturing company, and they were looking for a very particular kind of engineering skill set that they were not able to find anywhere. So they actually found a practitioner in China and recruited them straight from China because it was a very particular skill set. So I said, well, what did you do with language? And they're like, we got an interpreter. We built into our budget an interpreter because this person's skill set was so critical to our business that the interpreter is worth the investment. So,
I do like the way you frame that. Why is the English language skill any different than any of the other competencies that a management team is prepared to invest in for their employees? So at the end of the day, it's a skill and a competency required for a job. Invest in it. But legally, you're not required to.
No. And many, by the way, many in the
audience, as we see them coming. We have one more question coming in, Uzma. See if I can get that. How do you get through? How do you get it through to companies that it's in their best interest to provide English language training?
Oh, I don't know. I mean, if they don't know that, they have a deeper problem than I think they have.
And I wonder if simply that that discussion being, it is a competency we require. We train for so many other things. Why aren't we training for this as well?
The reason, Christian, the reason I hesitate to answer that is because I work for the City of Toronto, and City of Toronto holds itself to a much higher standard to a certain extent in terms of accessibility to the person who's seeking an employment. For example, I would suggest for a large organization like the City of Toronto and a government, it would amount to discrimination. Because to my mind, unless they can show that it's a bona fide requirement, it would not be in, and I don't mean discrimination in terms of taking it to the Human Rights Code. I'm not talking about discrimination in terms of actual judicial sort of term. I'm talking about discrimination in terms of looking at someone's, focusing on the wrong part of someone's skill. There are a lot of jobs that do not require that level of English language facility. And there are a lot of jobs that do. And City of Toronto is very particular that we do not make language a requirement unless it is absolutely a requirement that doesn't allow certain people to get into jobs. And I'm not saying employers need to look at it this way, but employers, private sector employers actually look at it from a business perspective. As far as they're concerned, hire someone for their skills, and language is something they're willing to invest in.
Now, we certainly don't want to leave any employer, anybody in the audience with an interpretation around what we've said, that this is a legal grounds for discrimination. I think what we're trying to say is make the cost-benefit argument to your employer that the skill you do have in this particular employee is worth hiring and training on the English rather than simply dismissing on grounds of the English language.
Absolutely.
You know, as I'm looking at our time, Uzma, we do have to wind things up. And I think there's a number of different directions we could go, and we have to acknowledge that our focus here has been working on lifting and breaking organizational barriers to a more inclusive workplace. There's still a significant challenge for any company, lies in overcoming those internal personal biases and attitudes that employers and employees within that organization bring to their work. Organizational systems can be easily undermined when its constituents contravene these imperatives and desires that come from the top. So perhaps this is a topic for yet another webinar. But for now, we've been fortunate to hear about your practical and proven practices in one organization and a commitment of one individual within that organization. So Uzma, thank you very much for sharing your experiences and insights. As we wind things down, I'd like to just leave it to you, Uzma, for any closing thoughts.
I apologize once again if I was looking here, there, and everywhere, because I tend to forget that this is a webinar, but I hope that it has been instructive. I've thoroughly enjoyed it. It's a shame I cannot interact with people on the other side, but hopefully one day I will be able to come to Vancouver and actually see you guys face to face. But you know, if anybody in the audience has some brilliant ideas, please share it with us, because City of Toronto, we are struggling, we are learning and growing, and I would love to learn from all of you. Thank you very much.
Thank you, Uzma. And just stress again, the organizational best practices are critical. So we've got Uzma's contact information up there for all, and we thank you all for your time today. All the best to all of you.